Welcome back to the Healthy Commute. I'm Dr. Dan with Dr. Pascal. Today we're going to talk about scoliosis.
Yes.
As chiropractors, we do see scoliosis in our office, but I think a lot of times for people, we've heard the term, but may not fully understand the effects, especially on our overall health, but also like we don't assume it may affect even our kids. Right?
Yeah.
So we want to really help people understand a few things about what it is, how it affects us, but especially what could be done about it.
Absolutely.
So let's start from the top. So clearly, if we can help people understand what is a true definition of a scoliosis.
Okay, so before we talk about scoliosis, then let's define what a normal spine should look like.
Yeah.
So if you're looking at me right now, Dr. Dan, from the front, my spine should be perfectly straight from the front. If I turn sideways and you look at me from the side, I should have three very distinct curves from the side. If you were to look at me from above, so kind of right down my neck, if you will, you would see no rotation to the spine. So no rotation, three very specific curves from the side, perfectly straight from the front.
Now, in that position, again, to remind maybe people is that the spine's job is really to help us with our posture so we could kind of stand straight. But the key thing is the protection of the spinal cord and the nerves on the inside. And really what that basically means is that now we have clear communication between the brain and the body. So our Wi-Fi in our body is working well. Our brain could talk to our heart, our lungs, our stomach, our muscles. It could react and heal properly. So that's ideal.
Correct.
Right. So now, what does that scoliosis do to that normal spine?
So scoliosis, now remember we said straight from the front. So when we look at someone with scoliosis from the front, they're bent or they have a curvature from the front. So it's a curvature larger than 10 degrees when seen from the front.
Okay.
And then if I was to look from above the spine, it's rotated. So it has this corkscrew effect. So a curve larger than 10 degrees with rotation.
Okay. Now, what does it cause? What is a scoliosis? What's the big deal for me?
Right.
How does it affect us?
Well, a lot of people say like what caused the scoliosis, okay?
Right.
And so there are some like people that are maybe just born with some bone problems that cause the scoliosis. There are other severe neurological issues that can cause scoliosis, but those are really, really, really small percentages. 80+% of cases are just unknown. They call them idiopathic, and that really means there's no known cause. It just happens to the spine, okay? So most people fall into that. What does it cause in adults or in people? It can cause pain. It can cause cosmetic issues. It can cause neurological issues, again, because of the fact that we just talked about. It can start, compressing some organs. It can start stressing nerves that go to organs. Mm-hmm. And obviously, the curves can progress throughout time, getting worse and worse.
Okay. So, is this a child issue? Is this a teenage issue, an adult issue? Who does this affect?
Great question. I think if you mention the word scoliosis, almost everybody's automatically going to assume teenagers, right? Mm-hmm. That's kind of like what we've been wired to think, and that's where it's probably seen or found most commonly. Mm-hmm. But scoliosis can affect everybody, from infants right up until people in their 90s. And actually, what we call the prevalence, so the percentage of people that have it, mm-hmm. starts out really small as infants and then keeps getting bigger and bigger through life. So the older we get, the more likely we are to see someone with scoliosis or have scoliosis.
Okay.
Does that make sense?
Yep.
So we commonly, again, they're found about 2 to 4% of teenagers will have it, and up to 30% of adults 60 plus. That's a staggering number, right?
So basically what you're saying is 2 to 3 out of 100 kids will have scoliosis.
Correct.
But 30 out of 100, late adults
yes.
will have scoliosis.
Correct.
That's a massive difference.
That's absolutely a huge difference. And the reason that is so let's take those, we can even round up. Say there's 5% of kids that have it because there's some that maybe aren't found.
Yeah.
Right? So now you have those 5 that'll have it for life,
mm-hmm.
right? And they'll obviously continue to have it in adulthood. But that other 25% is breakdown throughout life, right? So if someone has a bad spine throughout life or has subluxations, positional problems of the spine, as gravity continues to sort of beat us down, if we're not doing things to reverse that, your spine can continue to buckle further and further into that problem until it develops what they call adult degenerative scoliosis.
So meaning that, let's say I'm 20, I'm 30 years old, I have a car accident, I have an injury,
Yep.
I sit at a desk all day,
Yep.
I play hockey on Friday nights, and all this stuff just continues to build and wear down my spine.
That is correct.
And then I just continue and degenerate more and more. And now, in my 60s and 70s, now I've got this degenerative scoliosis.
Yes.
Okay.
That's exactly correct. Okay. So that's the thought process of how it develops. Okay.
So how do we detect it? So if I'm considering, okay, well, do my kids have scoliosis? Is there anything that I could do at home to check?
Absolutely. Great question. So the first thing you want to do is have your child take their shirt off and you stand behind them. Okay. So we're going to look for things that are uneven or unbalanced. So the first thing is you would just look at someone's shoulders. So behind the shoulders, they should be even. So if one shoulder is sitting higher than the other, that's a sign. Okay. Shoulder blades, they should sit flat on the rib cage and they should look the same. So if one pops out more than the other, that can also be a sign. We come down to the waistline, so between the ribs and the hips, the waistline should have a symmetrical or identical indentation on both sides. And with scoliosis, often one side of the waist will appear flat and one side will have an indentation. Okay, so there's another sign. The hips, sometimes if you look at the pants and just look at where the belt sits on the hips, if it's not level with the ground, if it's sloped one way or the other, that's a great indication that there's some shifting or twisting in the pelvis there that could be a problem. Okay. Oftentimes too, if the teenager is thin, and that's why we see it in teens, is because they grow from their spines quite quickly and they're pretty thin. And so you can actually physically see the spine on them. So if you can see any type of shifting or curvature sideways in that spine, that's a clear indication and a problem. Okay. Lastly, a good one to check too is we call it the Adams test. So you have the child put their hands together and imagine they're almost like rounding their back to dive into a pool. So you're bending forward, rounding your back with your arms hanging. If you see any bumps on the back, low back, or rib cage, that's that sign of the rotation we talked about, and again, another sign. So, if you have one of those signs, you still want to get it checked out. If you saw 2 or 3 of those in your child, then there's really, really a much higher risk that something is happening there.
And what about older adults?
Older adults, oftentimes this is going to be a postural shift or pain. So, I'm sure you've seen it yourself, Dr. Dan. Someone comes to you saying, hey, my back hurts here, doc. It hasn't hurt. This is showed up 2 weeks ago. But you see the signs on x-ray that they have an adult onset scoliosis, this big shift in degeneration. So there's 2 things. It's postural shift that a spouse might see in you, and the other one could be pain. Pain would be the biggest one. And then a spouse saying, hey, I notice you're shifting more and more to the side, or you're kind of leaning over lately. Those are the 2 biggies or red flags for adults.
The classic ones that we've usually had from patients is let's say if there's an event like family pictures or a get-together and maybe someone hasn't physically seen a person in a few years and all of a sudden they notice you're shifting over to that side, or in the picture everyone's nice and straight and someone's shifting over. And those again may be signs of again a scoliosis.
Absolutely.
Yeah. So what's the conventional approach usually to a scoliosis? What would a typical person, let's say if they say, I'm concerned that I have a scoliosis, I'm going to go see my medical doctor or physio, what would normally be done?
Okay, so again, it depends when it's found. So typically when it's found in adolescence, if it's found when a child is rapidly growing, if their curve is less than 20 degrees, it's the old approach that says, let's just watch and let it get worse, unfortunately, right? Let's hope it doesn't get worse, but let's just wait and watch it. And if it gets worse, then we'll do something later on. Once that curve breaks 20 degrees and it's in the 20 to 40 degrees, so a pretty big curve, now because it's really becoming a bigger and bigger risk that it could become surgical or start affecting neurology and lungs, they'll put you in a brace. Okay, and then from there, if it continues to progress and it gets about 50 plus degrees, that's where they consider getting in there and doing surgery to prevent it from getting worse and trying to stabilize the spine at that point. Okay, so that's the traditional approach. Watch and wait, brace plus 20, surgery above 50.
And so what's different that's been basically done, especially for modern spinal correction,
so
in the last, especially 5 or 10 years?
Yeah, well, we know it's actually the watch and wait approach really isn't the best way to go about it, because your window to correct it is when that curve is smaller. It's like any other problem. The smaller or the sooner you intervene with a problem, generally the easier it is to fix, right?
Like braces for teeth for a 13-year-old or braces for teeth for a 40-year-old.
Yeah. Or an oil change on your car versus replacing the engine, right? Yeah. It's the same idea. The maintenance maintenance or the small things early on can really make a big difference. So with modern spinal correction, we have techniques that include all kinds of things with adjustments and exercises and home care tools, and even some new advances in called 3D correctional braces. We can do things to reverse that and not only prevent it from getting worse, but oftentimes when caught early enough, we can totally correct it so that someone that had scoliosis is scoliosis free. The larger that curve gets, the harder and harder it becomes to do that. Now, we can still stop progression and help correct, which in the, I guess, the typical healthcare world, they'll tell you once you have it, you can't do anything to correct it, which is not true. I mean, we see kids of all ages and even adults, and we help them reverse some of those curves, right? Mm-hmm. But the older you get, the larger the curve gets, the harder and harder it gets to bring it back as close to normal as possible. So in modern spinal correction, the complete opposite philosophy is true. The earlier you start addressing this, the better the long-term outcome.
And I think knowledge is power, right?
Yeah.
I think a lot of times it's scary to get information where it's like, oh, well, if we do something and we find out some bad news, then that we don't want that bad news, so we avoid getting that information.
Correct.
But this is so crucial that the earlier it could be checked, detected, and corrected, definitely the better.
Absolutely. Right? And having said that, sometimes people will say, well, when should I start checking my kids? But if you have any concerns and you want to get them checked, there's no harm in bringing them. Pain, no pain signs, no signs, bring them. Just bring them to a chiropractor who's trained in this. Have them look at your child, do a posture assessment. If there's any concern, they can go in, take an x-ray, and just rule out any problems. Excuse me. The real key age for girls is between 10 and 12 years old, and boys about 11 and 13. That's where you really want to start checking them yearly or twice a year. Okay, and here's why. So up until about 10, 11 years old, kids are going to be growing from their long bones, so their legs and their arms. And so, there's very little risk of a scoliosis or any type of shift in the posture getting worse if it's there. But all of a sudden, once they get 10, 11, the long bones, so the legs stop growing, and you're going to grow from the spine. So imagine if there's this 15-degree shift in there, and all of a sudden you start having this rapid growth. Well, if someone's crooked and they're growing really fast, they're going to grow crooked even faster. Does that make sense? And so that's why it's really important to try and get them checked really early on, ideally, in those early stages before the spine grows, because if you can get in there before the spine grows and straighten it up, they'll grow with a much nicer, straighter spine. Perfect. So 10 to 12 for girls, 11 to 13 for boys. That's the crucial time to get them checked. Whether or not you think there's an issue, get them looked at.
Okay. Anything else we haven't covered for today?
I don't think so. I think the biggest thing is just understand that, if this is something that you already know you have, there is hope that things can be done to help you. So don't think that, you're stuck with this for life and it can never be improved. And I think that's the biggest thing we hear from a lot of scoliosis patients is there's no hope that something can be done. And so to the contrary, there's definitely hope that you can definitely be helped and improve this. And if you have any comments or questions or concerns, feel free to reach out to us. We'd love to just sit down and chat with you and help you if possible.
And also, if you are somewhere else other than Winnipeg, or even in Winnipeg but away from us, we would love to help find someone that could help you closer to wherever you are. So you could either give us a call here at the office, 204-474-1159, or email at info@lindenwoodschiropractic.com. That's it for today. Thank you so much for listening or watching, and we'll see you next time on The Healthy Commute.